Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Talking Head Pain, the podcast that confronts head pain head-on. I'm your host, Joe Koh, Director of Therapeutic Area Growth and Integration at the Global Healthy Living Foundation, and also President of GHLF Canada. For today's special episode, I'm at the European Headache Congress in Barcelona, Spain. I'm here with a very special guest who just spoke about Botox and following the pain. Can you introduce yourself and state where you're from?
Hi, everybody. My name is Jana-Isabel Huhn-Doll, and I'm a neurologist and pain specialist from the beautiful city of Essen, which is in Germany.
Very nice. And I just had the privilege of listening to you do a presentation about following the pain and Botox injections. Can you explain what that means for our patient and provider community?
Yes. As you know, that Botox is used for patients with a chronic migraine, which means patients having more than 15 headache days and 8 of these being a migraine typical. And Botox is a good medication in the preventive treatment of migraines. And the Botox PREEMPT scheme means that we inject patients with Botox in 31 areas of the face and pericranial muscles. And follow the pain means that you have the opportunity, if the Botox is not responding very well or if the patients are not responding well enough to Botox, that you actually follow the pain. That patients tell you, my predominant pain is in the back of the head or in the trapezius area, and you are able to do more injections and have a more tailored and individualized approach to their headaches.
That's really important. So as a patient, if I'm having more pain in my traps, I should tell my neurologist that.
Yes, definitely. This is what Follow the Pain is about, that you and the patients together look at the tenderness of the muscles to decide where does the pain start. Does it start on one side or both sides? And you are able to do the injections in the specific areas.
Thank you so much. Really useful information, and shared decision-making in medicine is so important. So thank you.
Thank you.
Thank you for listening to this special episode of Talking Head Pain, the podcast that confronts head pain head-on. If you have any questions, thoughts, or suggestions for us, you could send us an email at podcast@ghlf.org. If you enjoyed this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing it with your friends and family. I'm Joe Koh from the European Headache Congress, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.